balance of his time. Gentleman from Pennsylvania.
I think the point, thank you, Mr. Chair, but I think the point we are trying to make is that this should be about economic policy, that the Republican leadership's refusal to address the Trump tariffs and the damage they've inflicted upon our economy and upon American families' pocketbooks should be the topic before the House, instead of these make-weight bills that are never going to become law. Look, at the start of 2025, the Republicans knew there were two big tax provisions due to expire at the end of this year, now within the next 10 days. One of them was the 27 Trump tax cuts, which overwhelmingly went to the wealthiest Americans, and the second was the ACA tax credits that help millions of Americans afford health insurance. This has been known to everybody all year. Now, our Republican colleagues made the choice in their big ugly bill, which they spent so much time and energy on this summer, to extend the Trump tax cuts for the wealthy. And they have also made the intentional choice to let the ACA tax credits expire. In doing so, they are causing the premiums for 22 million Americans to skyrocket. It is likely that millions of Americans will lose their health coverage this year due to our Republican colleagues' failure, refusal, in fact, to address that issue. So when we hear our Republican colleagues talk up their health care bill that they're trying to bring to the floor this week, know that their legislation will not renew the ACA tax credits. It will not lower premiums. It will not lower costs. 80% of the bill is simply new paperwork requirements for pharmacy benefit managers, and the parts of the bill that do involve health care costs are horrible. They basically want to sell Americans junk insurance policies, and people know about these. These are the policies that have low sticker costs but terrible coverage when you need it. So we really just have been imploring our colleagues to come to the table, to try to do what the American people need them to do so that Americans have health coverage when they need it. And we have not seen them be willing to do that. That's why we have a discharge petition sitting there at the desk. We just need 4 Republicans to join all of the Democrats in the House to force a vote to extend the ACA tax credits, and we would invite them to do so. And with that, Mr. Speaker, if we defeat the previous question, I will offer an amendment to the rule to provide for consideration of H.R. 6074, which would extend the Affordable Care Act enhanced premium tax credits for 3 years through 2028. Mr. Speaker, for months, Democrats have sounded the alarm about the expiring enhanced premiums, urging the Republican majority to join us in extending these premiums before the end of the year so that all of our constituents can get the health care coverage they deserve. Millions of Americans have already received notices from their health plans that their premiums are going to skyrocket starting January 1st of 2026, just a few days from now, in some cases by over $1,000 a month. The median income in my district is about $80,000 for a family of 4. They can't afford an additional $12,000 a year for health insurance. But there are only 3 legislative days left to fix this problem before the health insurance costs of over 20 million Americans rise. But this Republican majority has ignored and blocked any effort to extend those credits. The majority even told their own moderates they won't get a vote on the floor to extend them. So I'm happy to give them that vote right now. We can defeat the previous question. We can consider a bill that would extend the ACA enhanced premium tax credits for 3 years. There's no more time to waste. The deadlines are all passed. We have to act now for the American people. So, Mr. Speaker, I ask unanimous consent to insert the text of my amendment into the record, along with any extraneous material, immediately prior to the vote on the previous question.
Without objection.